Hi, I'm Ruth Werner, and it is my joyful task to spend a little bit of time with all of the presenters who will be speaking to us at the 2021 Alliance for Massage Therapy Education Congress happening July 16 and 17. And the person that I get to introduce you to today is my new friend, Lizz Pugh, who is going to be presenting a class that is surprisingly relevant to everybody. So the class that she's presenting is called Trends in Anatomy Education, and that will be happening on Saturday, July 17th. And Lizz, first of all, would you just introduce yourself a little bit?
Sure. My name is Lizz Pugh. I've been a massage therapist since 2004, an instructor since 2008, and a continuing education provider since 2017.
And you just finished your master's program, right?
Correct.
In
instructional design.
In instructional design. Excellent. So tell us why any kind of massage therapy educator should attend a class with the topic of trends in anatomy education. Isn't this just for anatomy teachers?
It is definitely not just for anatomy teachers. And by the way, thank you to all the anatomy teachers out there, because you have a very hard job. And I think that we all hold the anatomy teachers in a little bit of awe and think, oh God, I'm so glad I don't have to do that, right? It's a lot of information. It's very complex. But I would love if every person attending this walks away with the idea that the responsibility on teaching anatomy and physiology is every single teacher's responsibility, entry level and continuing education. It's not just the anatomy teacher.
Why would you say that? Why does someone who teaches ethics need, or marketing, or some other topic that's not directly related to hands-on, need to know about trends in anatomy education?
Massage therapists and body workers are affected by their knowledge of anatomy and physiology in every single aspect of their practice. And those who are teaching any sort of massage therapy or body worker needs to be able to communicate things like contraindications. How do we safely work on the clients? How do we adapt the sessions for people who are medically fragile or have recently had surgery, for example? So in most cases, anatomy and physiology is going to be directly relevant to the session outcomes. And, it's its own language. And in order to really become fluent in that knowledge of anatomy and physiology and to use those terms and to not struggle with it so much, that has to be reinforced. And if every teacher was reinforcing the terms and the concepts at every level, I think as a profession, our vocabulary would increase greatly.
Oh, you're singing my song. I want to ask you one more follow-up question, which is about the trends bit. How is it that anatomy education is any different from how I learned it a million years ago?
Well, thankfully, there has been a lot more information on educational psychology and what the difference is between adult learning versus learning in childhood. And we can take those principles and apply it to make our classes that much more effective and potent. Because it is a struggle. It's a challenging topic to teach. It's a challenging topic to learn and understand. And I think as educators, our job is to make it as easy as possible for our students to take that knowledge and then integrate it and be successful with it.
Great. Well, I for one am really looking forward to hearing you speak about this. As a pathology educator, I feel like I can't do my job if I haven't done a review of the relevant A&P first. So this is all work that's going to be very, very important. Thank you so much for spending some time with us today. I can't wait for your class.
Thank you, Ruth.
All right. Take care.